This is part 1 of the 4 videos showing techniques for capturing and sampling wild animals.
My name is Dr. Mircea Jovan and I'm a wildlife veterinarian. I work in public enterprise Vojvodina Forestry, Vojvodina Šume, in the north part of Serbia. My main duty in this company are monitoring of wildlife health. I basically work with population of various game species, large and small. Today we need to highlight 2 key points. First is safety and welfare. Safety is safety for animals and safety for humans. Animals of interest in our case about European wild ruminants. In first line it's red deer, Cervus elaphus, and second are fallow deer, Dama dama, and roe deer, Capreolus capreolus, and mouflons or chamois, and on the end wild boars. Wild boars are species is not ruminant, but it's one of the important species in the aspect of big games. When we talk about method of capturing method of for wildlife, we have basically two groups of methods. First is physical capture, basically is restraint, and next is a chemical immobilization. Physical capture in our context, or this East Europe, basically Europe, it's a trapping, net gun, or drop net. Chemical immobilization is basically remote drug delivery using dart gun, dart pistol, or blowpipe. When we talk about trapping is basically a corral system with a pre-trapping facility where we catch animals and the trap where we restrain animal that can move and provide sampling on what we want with this animal. Basically, trapping is good because we can capture individual or group animals. We can select some animals. If we trap 10 animals and we need 5, we can choose what category we want to sample, what category it's good for us. We can create a lot of space for us. Trap facility can be used multiple times. It's acceptable. We can use for different animal species. We need minimum 5 persons for trapping because trap facility have a lot of doors, and we need a lot of pair of hands for simultaneously work. Trapping can create a high to middle level of stress for animals, and animals can be nervous, but good thing for trapping is everything in trap facility we provide fast. For 5 to 10 animals we need less than 1 hour to catch them, sample them, and release them. It's really fast. Second method is net gun. Net gun in context of Europe, it's not really successful story. Reason is can create a lot of risky and dangerous situations, and requires high trained staff. Basically, we can with net gun we catch only individual animals, but mistakes happened, and dart gun is not for Europe and for mixed forest, bushy area. There is not good story. For probably Africa, savanna, flatland, grassland can be good story. Number of participants basically is 1 to 5, depending of condition of animal and type of animal, species, and the level of training of personnel. Net gun create high level of stress for animals and high level of stress for personnel. Drop net. Drop net. Difference between net gun and drop net is because drop net are up than feeding place, and we waited some number of animals come and we released these net and capture them. We basically try to restrain one group on one location by net, and there is high risky activity, can provide serious damage at animals and serious injuries at persons who provide that. We try to skip this method for large game species, but these methods are really good for small birds, for rabbits, and for small games, because it's easy for handling. Chemical immobilization. Basically, point of chemical immobilization is remote drug delivery by using dart gun, dart pistol, or blowpipe. We can use in supporting method for trapping. If we have some animal in problem or an extremely nervous animal, we can use chemical immobilization inside trapping facility. We basically capture individual animal, request low financial investments, and we need to check place where we want to provide chemical immobilization, and need to be dry terrain, not swampy, and not a lot slope, not dense forest. Okay, brand new. There is dart gun. Dart gun with optical device. We have oldest but good, excellent dart gun without optical device. And there is additional barrel. One is 30 millimeter, one is 11. It's completely second. This is dart, this is CO2, triggers, compressors, and when you package dart package without this. Never with this. When I know that is right here, if it's under pressure, nothing happens. Pressure go outside. If it's something released inside, there is, and always look dart from this side. Now, this is gun. It is dart gun and can wound you. It's the gun. After that, we talk a little bit about that. When we talk about chemical immobilization, we need to choose what drug we can use. We choose drugs according species. It's not same drugs for, we not prefer same drugs for red deers and wild boars, but these drugs need to be approved by country. And there is for us a little bit restriction, because we need to choose drug or drug combination from list of approved drugs for our country. The chemical immobilization are method which create low stress for animals, but for personnel is high stressed, and we need a lot of time. For one animal we need more than 2 hours to immobilize, to prepare, to sample and release and recover. And there is 2.5 hours for per one animal, per site, per day. Basically, if you want to catch another animal, we need to change location, we need additional time for performing. There is tool what I need to observe, binoculars, what I try to inspect. There is pre-darting control. Condition of animals, are animal healthy, what we want. male, female, which category? Young, with antlers, what is goal of darting, immobilization, what is the sample? Maybe we have 3 animals on site, we need to pick up 1. And we prepare those. How we prepare those? The biggest mistake is calculating without paper. You need to double check everything. Okay. My colleagues in first line joke with me. Why I do that? Okay. There is simple Excel table. It's simple. What we do? It's deer, it's those, and I create for me. I can, when I see, I exactly know what is those. But if we have 120 kilo of deer, I type right here 120 kilo. There is zoletil, how we use aqua and powder in what, and second is detomidine and derivative xylazine. And there is Algor is 5 mils. After that I explain you why. And after that I know what is those 4.81 and 1.44 mil of another combination. And feel this barrel, this dart. And when I prepare everything, sometimes we have animal of 80 kilos and have animal of 180 kilos. It's totally different. But I need to prepare same weight of this dart because shooter calculate distance, wind, and need that barrel and weight of this dart be same. My job is to prepare always 5 mil. He know how to hit deer, but only with 5 mil. Force and distance, it's total different if it's different weight. And what we do, if we prepare for 4 mil, I add 1 mil of aqua proiezione. And sometimes it's 5, sometimes it's 3, but always we need to add solution, diluter. Yes, there is extra diluent for zoletil. And we use these to fill this empty space. I finish for 80 kilo, right here, 80. Finish for 180, because shooter go outside without this is not in barrel. And he try in one moment, okay, this is 180, and there is 80. Because it's same weight, but it's a different dose inside. And there is important, marked everything.
Who wants to help? Volunteers?
There's guidelines. Deer, raw deer, but 20 kilos. Zoletil, 100 zoletil in this concentration. Diluent 5 milliliters, powder, okay. From these, we need to pull out 1.8 and additionally from detomidine 0.24. Gloves, please. And filling this dart is necessary that you use goggles, these protective goggles. This.
Okay.
You hit right here. Press.
Okay.
And there is something. And next, you can use like flip. Yeah. We call it that. And it's twisting. Please.
The whole.
Hole. complete. No, it's okay. Complete. Okay. It's okay. Just no, pull. Yes. No, it's not a problem. And just no, like this. Yes. And you see,
Yes.
it's vacuum and pull. Okay. And after that, pull out. And there is, yes, thank you. There is for garbage. You can use these for needle if you need, but right here, okay. Leave. You need to leave maybe 1 minute. It's crystal. Yes, to dissolve. There is empty. Go in garbage. Okay. Next is drama 7. And right now you calculate 0.8 plus 0.24. It's 401.24. Okay. And you use these small and green. It's better to use green. Okay. Just a little bit late. You can always, because there is something what it's diluted and you can use for more times. If you have new needle, first take anesthetics from these and move. And this is, we use what we use. After that we throw out. Yes. From right here, you need 0.24.
Does she need the goggles?
No. Goggles is, I explained that there is risk factor for goggles. And it's mandatory for goggles. 0.2. 0.2. Between 2 and 3. Yeah, 2, 3, okay. And you need 0.8. There is
The whole
1.04. Yes. You need to see needle inside that is in the middle of liquid. But never pull back, just because you have slowly 1.04. You are leader. Not me, I don't see that. Okay. And it's prepared. Okay. We start to prepare darting. We need to choose gun or blowpipe. Okay. If we choose blowpipe, we have different type of darts for blowpipe and a different type of needles. There is dart. It's 11 meter of diameter. And what is process? These dart have 2 barrels. One, it's connected. It's basically is with two. Yes, it's not triggers. It's a small piece of sealing. Okay, and that moment you get pressure. Okay, right here you have 2 bars. One right here, and these right here. It's same principle like this dart for gun. These small piece need to stop to create compressed air right here. And right here go liquid. There is anesthetics in some amount. And you feel inside. You are inside and you feel. Okay, it's filled. There is so similar needle with this red needle, but is closed, and have 2 holes by side. Okay. Put needle, and you have this small green or red, depending on size, piece of rubber. what is this piece work? Prevent that these liquids go outside through these holes. Leakage, yes, leakage. And you pull this. Okay, it's completely safety right now. I think that I feel good. Okay, and what happened next?
Can I take a photo?
Yeah, and it's why it's right now you need this. Why? You create pressure in these, and if it's not good placed, this piece, and you create pressure in this part. But right now it's water right here, and you put inside. What happened? These don't move, and preserve pressure inside. Okay, there is prepared, and this is stabilizer. It's ready. What happened? You put inside and dart, and in contact with animal. Go through skin, go inside, and these rubber go in this direction. It's okay. In the moment it's water, it's not problem right now. It happened that you can see. There is moment of application and can stay. So you deliver this amount of drug to animal intramuscular. Place for hit, it's where is enough muscles, basically back of the legs, behind. This is some triangle. Barrel need to stay right here, like this. If you feel compress air, bottom, liquid up, always. Please go outside. Znam. Samo oni. Ok, to vi sad probajte. Pa vi probajte. Probajte koliko uspijete. Ja, ok. Okay. Inside we have pressure. Inside. Okay. Inside is one cartridge of CO2. Yeah. It's CO2. Yes. It's this. It's CO2. Put inside and struggle, and you create pressure in this system. You have barrel. You have dart. Okay, we use this. There is smaller. It's 3 cc's. There is 11 millimeters. There is barrel of 11 millimeters. There is 13. These can go inside. We imagine that we are prepare everything and put inside and locked. There is prepared for shooting. You move this optical. Okay. It's not safe inside. Okay. And what is next? It's empty, it's not. You have right here pressure. This command explain you positive, negative pressure and what you want. I set on some pressure 5 pascals. It's optical. You can see from this optical device animal, but if you try to do something under 10 meters, there is not precise. Why? Because you don't see whole picture and you can easily miss. You need to train with these optical to know what is your minimal and what is your maximal distance what you can shoot. Minimal are 5-7 meters for good shooter, and optimal is between 10 and 20. And it's easy. It's break, red, it's ready to fire. I don't know. And there's. And it's not so fast. On 25 meters, when deer heard that, they move something like half meters. And you need to predict. And there is reason why it's worst thing that you hit deer. Hunters like to hit deer by side. You want to hit deer by back. Why? If move forward, the same line like trajectory of dart. It's not. If you are precise, from back is best darting. We have options, but what is best capture? What is best capture method? Basically, for this part of Europe, we use two methods of capturing: chemical immobilization and the trapping facility. When we try to decide what method we can use, we need to think about number of animals what we want to capture and sample, purpose, why we do that, existence of infrastructure, locations of capture, training of the persons, and according these our activity, we need to be informed or provide proving documents from ethical commissions, for veterinary directorate, for forestry directorate, for different agencies which are interested in this part of our jobs. And our advice and advise our colleagues is always create balance between what we want and what we can. There is something what is smart using of equipment, personnel, and time and money, and we need to be realistic. If we choose our trapping method, we need to choose locations. Trapping facility need to have access to road, and basically we need to provide conditions that we can come with vehicle and trailer and equipment near the trapping facility. Chemical immobilization, open field, sunny, with lower lower density of vegetation, good overview of the terrain, grassy soil base. Access areas which we need to avoid for chemical immobilization are wetlands and is dense forest, large slope of terrain, dense vegetation, stony ground, and area with low reduced visibility, like no sunlight area. Why? All of these areas can produce some kind of damages. For example, large slough, we can see overturning of animals, dense vegetation, we can find animal, or dense forest with big trees, and stony ground can provide injuries by hitting animal in tree or on the face of animal, damages according to hitting some stones. Field safety. When we talk about field safety, there is one of key points: safety. mandatory is that all staffs all personnel need to wear protective equipment. We need to prevent all biological hazard, prevent a chemical hazard, prevent medical hazard. Waste disposal management. We need to introduce all stuff what we need to do with waste. Evacuation route. Use firearms. When we talk about evacuation route and use of firearm, basically we like to talk about that before starting of capturing or immobilization. Why? There is something what we need to deal. Where everybody stay, what need to do, what is evacuation route for animal, and what is opposite side of evacuation route for humans. Use of firearms is some for us important prevention method. Basically, we ask some professional hunter on the hunting ground, which is game warden, to provide us protection by arms in the case that we are in danger from animals. And there is something about this moment. People need to be familiar with gunshot, and a lot of people never heard gunshot. In the danger situation, we are in danger from animal. Some people freeze when first time heard gunshot, and it's important that the person be properly trained for almost all situations what we can expect in field. Before anything we do, when we come on location, we talk a little bit. What we do? We do piece of paper, orientate, probably 3 or 4 of us. We set what we need to do and draw. Okay. We expect that deer come right here on feeding place, and we expect in these locations is deer immobilized. Our car are set in this direction, right here. Our line of communication is this. If we need assistance of game warden on this location, we expect that game warden stay right here. Why? If stay right here, bullet can go on this side, there is end for bullet, or have good perimeter. Line of evacuation is this. Game warden right here. Perimeter for watching and shooting is this. You know? Okay. And there is something what is in 2 maybe minutes you figure out everything. First aid kit can be right here somewhere, or on the top of car, on the front of car, somewhere where is necessary. For first aid kit, you can use first aid kit from car. It's same basically. It's for first aid, and we prefer darting. There is something what we knew what somebody do. Okay, why I driving? Do you know why? Drive, always drive. Why? There is a tricky part from coach on basketball players, American football, or there is a reason why they drive. Not they understand, can talk them. Okay, you play this combination. No, he drive. Why? There is double information. You look and listen. And there is critical moment. I need to be sure that you understand what we need to do and what is safety procedure. There is a reason why I draw, especially if it's somebody new. When we talk about staff capacity, we need to figure out what is number of personnel what we need. Sufficient number of people for smooth work is mandatory. If we need 5 persons and we have we need 5%, we need to have these 5%. We need to avoid the presence of persons without responsibility. Basically create some mess. At least 2/3 of the participating persons should be with previous experience. And only 1/3 of persons can be without or with low knowledge or experience, and basically these 1/3 don't get any serious duties during the immobilizations or capturing. Basically, these persons need just to watch and learn what is process of capturing or chemical immobilization. People with the chronic disease like neurological, cardiac, epilepsy, inability to speak are not suitable for work with wild animals. Participants must be able to walk a minimum 5 kilometers, must be able to lift 50 kilometers. It's important that defined language. In some cases, we have colleagues from different locations, from different countries, and it's not important that everybody know foreigner language or our language. Basically, we need to know some important words for dangers and for escaping. There is words what is necessary, and we always try to define what is words for attention. Хочеш ти? Не, треба ми сам виходити. Йой. Йой. Смот. Ні. It's baby. It's baby. Спусти. Мара ще держати. When you pull, okay, it's too much. It's not. It's too much. Small. Small baby. You put syringe. You get an injection sometimes. Держи, вау. And we need to move. We expect in next 4 minutes that we see some effects. Small. And you can see it's maybe between 50 and 60, 70 kilo, maybe 70. It's too strong that it's problem with handling by arms. What do you think how look like if it's 350 kilo deer? And you put drop net or net gun or something like that. Gun, net, people, cars, everything go. It's really, really dangerous. It's not recommended. You need to have control. Important moment of planning for capturing or immobilization is that we can define what is season of weather, the best season or weather condition for capturing. We need first line defined species which we want to deal, and according these species, some part of years or day are not appropriate for capturing. Basically, mating season, it's high dangerous and increase. If we are present in forest, we are in danger from males in mating season. In the season of farrowing or lambing, of calving, we are in danger from mothers, from sows, from does. In period of last month of gravidity, female's gravidity, it's not smart that we perform some chemical immobilization or run some trapping in trapping facility, because we can increase abortions. And it's not on line of animal welfare. According deers shed their antlers between end of February until end of March, and in this period there can be a little bit nervous, but after that new antlers start growing, velvet growing, and if we capture deer in period of end of March to April, maybe in May, we can injure new antlers, velvet, and can produce serious bleeding and antler damages. Ideal time for capturing is late autumn to mid-winter, during the early morning or average daily temperature between 0 and plus 10 degrees. For animals, it's not problem if we run capturing or chemical immobilization at -5 degrees of Celsius, but for us is problem. Equipment is freeze, the trapping facility don't work properly, it's a lot of snow, it's a lot of ice, and can be problem for vehicles, for people, and for animals. Purpose of trapping and chemical immobilization, basically capturing, can be sampling. If is our goal that we sample from live capture and sample for live animals, and after that released animals, we call that non-lethal sampling. And during this process we can sample tissue sample. Basically it's biopsy and blood sample from vein of neck, usually different swabs, and fecal sample, urine sample, and hair sample. Okay. For example, we plan to take one swab and blood sample. Okay. You just ask, you see in a lot of movies or something like they buy some cover mask for okay. There is good, but never tied mask on the head of animal. Never. Why? If wake up and start running, we expect it to be without mask. This is completely enough for this. Why white? You can easily see and pick up after. It's same for animal, green, white, or, but it's important. Yes, that's fine. Okay. What we do? We look. Okay, it's not white. It's okay. For her, it's completely okay to do something like that. Nothing else. Okay. Bleeding. Deep anesthesia. In the moment when we first, what we do not help me. Okay, if you do like this for small animal, when I put in spool inside, please, you get negative pressure right here.
When you pull the needle.
Okay. It's on. Negative pressure, please. Okay. It's really, really small. Да, само trenutок. It's really, really small. Not like this. Brate. Just take this. Give me pulse. Too small. Yes, it's deep. Small. What you can do, what is technique? Vein from body, muscle and organs to heart. You put finger right here, this is right here, and place needle right here. Axillar right here. Something like that. And there is, if is arteria, like this, and jugular vein is this system. Arteria, like this. From heart to, you need to compress and create bigger volume of blood in vessel. Basically, it's something. Okay. What time is right now?
13:17. What parameters are okay?
There is okay. There is okay. Under 70 in deep anesthesia can be problem. It is 80, and depending on respiratory rate is slow, oxygenation is it's very bad, and there is reason why is a problem with hot temperature. They get less oxygen in same volume. They don't have enough oxygen. There is reason between being on North Pole in winter or in a hot time. Okay, it's stable. Problem is with if you have 85, 90, and one moment you drop and you see 1, 2, 3, 4, 1, 2, 3, 4, 1, 2. There is okay. 1, 2, 3, 4. Unstable. Critical moment of anesthesia is after first 5th minute. There is moment when you can expect, if you expect that anesthesia be something like 30 minutes, you don't have problem in 25 minutes of anesthesia. 5th minute can be problem. Okay. You see?
Yeah, the pulse.
Yeah. Do you want to try?
Yeah.
It's baby system. It's okay. You go inside like this. Yes. And
Better if she comes from your side.
and
Yeah.
do you want?
I think
Okay.
Do you need negative pressure? Okay.
Can you please negative
Yes.
and it's small. No, I don't want. Okay. Her position, according immobilization, are correct. Mine is not. When you try to come and do something with big red deer, her position is perfect. Never stay right here or up then antlers or right here. Position right here, it's okay. Her is perfect. Mine is bad. if start running, I'm on first line. The safest place is right here. And when you work with animal, it's big animal. For it's you stay always you leave one hand on animal. Why? Animal never attack on like jump, just jump. No, never. First you feel some muscle moving, preparing, some shaking, maybe few seconds, and there is something, you know that something will happen. In that moment you need to go back, and very critical. You know, and there is a reason when I am in this position, and or her is this position, my view is like that. I don't see what happened in forest and everything else. I don't know what you do. I look on this animal. If some animal try to attack me, I'm perfect target. There is reason why I need my colleague with firearms, with gun in behind me, because in that moment I'm not under stress and I know that he will preserve my life basically. And there is reason why I need assistance. I need to be focused, not every few seconds something like that to do. Okay. Swabs. Different type of swabs. Okay. Do you want? Elbow. Okay. No. Okay. We can take any kind of swabs in this condition. Basically, you choose. You choose. It's your opportunity to do. You ask them to provide you some pictures of that. Okay. Perfect. And after that,
Is she okay?
yeah, I know, little bit. I try one more and this last. If I done, if not, not. Okay.
Third time the charm.
Yeah. And it's blood. Why I use this, not exactly. Can you preserve me, please? Just without, no.
You need this.
Yes, and this. Why I don't do, it's easy. Why not like this? If you try to do some research and try to get perfect sera, it's not important what is vacuum tube. If you want perfect sera, you don't need vacuum inside, because you have a lot of damaged erythrocyte. And the best moment is, please fill in inside. A little bit more, a little less. Okay. Thank you. And label, always little bit shake and leave under room temperature. The best way for laboratory is syringe, needle, transfer inside. What time is it? Yeah. 1:26. Okay. We are right now in probably 25th minute of anesthesia, and when I come, I heard this deep snoring sound, but it's okay. 1, 2, 3, 4. Before waking, you see one deep inspiria. There is moment when some center in brain receives some information, something, and after that, same. You have 2 minutes, maybe 3 minutes. There is moment, there is last sign that you need to move from animal or add, yes, deeper. And you need to add anesthetics or sedatives, what you want, what you need, what you have, what you plan to get, and you or leave. Okay. Okay. Can you help me? Okay. There is something that we can provide during the non-lethal sampling, but sometimes we need to take samples from dead animals. There is a lethal sampling. If we procedure for big game are not that we capture them and after that sampled. Capture, euthanize and sample for lethal sampling. In case of a big game, basically we provide additional sampling during the regular hunting season. Basically we ask hunter to inform us when they provide hunt, and we come and sample in process of evisceration of hunted animals. If we have some disease or problem, basically we don't catch animals in population. We provide sanitary hunt or hunt in diagnostic purpose. Sanitary hunt and diagnostic purpose can be provided only according instructions of veterinary episthesiologist and veterinary inspector, and these hunt provide licensed person on the basically professional hunter on the hunting ground. There is game warden. After these hunt, these animals are just for sampling. It's this meat don't go on market. Basically, it's only purpose of sanitary or diagnostic hunt are sampling. Sometimes we found or somebody explain us that he found and we need to sample dead animal carcass, and if we have fresh dead animal carcass, we can sample the same things like from lethal sampling during the hunting, from hunted animals, or during the sanitary hunt, or hunting in diagnostic purpose. Basically, we can sample organs like liver, kidney, spleen, or tonsils or lymph nodes, and the blood samples. When we start sampling, we need to have idea what we want with these samples. And there is reason in the case of blood, we have a different type of vacuum tube, and we need to properly choose sampling equipment and we need to create a good sample for a laboratory. The best practice what we can provide are that we inform us basically we ask a laboratory what is the best way of sampling and what equipment we need to do, what is process of shipping and what is process of packaging these samples, because laboratory have different protocols, have different equipment, and basically we need to adapt our activities to laboratory needs. If we find carcass in summertime older than one day, or carcass in winter period older than 3 days after dying, there is a decreasing moment of capacity of sampling, because in the completely decomposed carcass we can sample basically tubular bone, teeth, some hair, or maybe a piece of dry skin. Indirect sampling is when we collect feces or hairs or saliva from places where animal live on the road of migration, but problem is indirect sampling is it's high possibility of contamination, and we almost never can connect sample and animal. Basically, we know that samples are from some population, and these samples are good for confirming presence of some pathogen in population or some genetic studies. During the capturing, in some percent we can accept of fatal complications, and the main fatal complications what we can see can be capture myopathy, hypothermia, hyperthermia, a different type of injuries, pneumothorax, ruminal tympany, vomiting, and regurgitation. Sometimes we provide all conditions for successful capturing, but these fatal complications can happen. In our experience, something like few percent of captured animal are with fatal complications. There is something like 5% of all animals what we capture, and we capture more than 250 animals. 5% are with fatal complications. The main problem with capture myopathy is how long we capture these animals. We need to be fast. Capture myopathy is characteristic for trapping method. If we are not fast or we don't have enough people, capture myopathy can happen. Hypothermia and hypothermia, if we capture or immobilized animal in poor body condition and with small body mass for species and for category, in winter time hypothermia we can expect hypothermia. Hyperthermia, high body temperature, a lot of activities, running around, and large and intensive insolation can produce hyperthermia. Injuries, hitting in trees, hitting in doors of capture facilities, hitting by head to rocks can create some injuries, in some cases seriously, and fatal complications. Pneumothorax, it's often but not fatal in case that we missed by best place of darting. We missed back legs and hit between ribs, and in that moment we can produce with our activity pneumothorax. But usually pneumothorax we can see in injured animals where ribs are broken. When we talk about ruminal tympani, bloat, basically for wild ruminants there is something what we can expect in inappropriate lying of ruminants. And for us is important if you use chemical immobilization, there is side effect of some drugs. They stopped intestine activities and they create slow motility of intestine, and effect of these drugs can be ruminal tympani. If we need to provide euthanasia, we always suggest that veterinarian perform euthanasia, or in some extremely cases trained person, but only according the regulation or recommendation of country or domestic administration. Important thing in capturing process and immobilization, chemical immobilization, are legislation. What are our maneuver? What are inside of aspect of legislation, law, ethic standards? We need to be informed about national or international laws, agreements, recommendations. In case of wild ruminants, it's a little bit tricky moment. If we see red deer in the forest in moment of walking and his life in forest, he is under jurisdiction of hunting law. But if we start capturing and or chemical trapping or chemical immobilization in the moment of when we capture animal, there is under welfare law and it's a totally different regulation. Basically, law treat these wild animals from nature and same line like farm animals or zoo animals. And during the sampling and until the moment of releasing animal, there is treatment like farm animals. When we released animal, wild animal, back in nature, there is again under the jurisdiction of hunting law. For us is important that we know these 5 freedoms for animals, and we need to know where is line. Line is created with ethical standard, welfare recommendation, welfare regulation, and we never need to step on this line. Because we always need to be little before that line. In the critical moments, we need to do something what is step on line. If we are in the moment of performing of capturing on the line, we don't have any maneuver space. On the end of this talk and informing about capturing, I want to again highlight these 2 key points: safety and welfare. It's mandatory that we and animals be safe, and welfare of animals according to these 5 freedoms need to be provided for these animals.